You're listening to the Good Question Podcast with Richard Jacobs. Our goal is to make each of our guests exclaim, that's a good question. I don't know the answer. Because when that happens, it means you, the listener, may be inspired to learn more beyond the interview and to ask great questions yourself that lead to new insights. In this podcast, we cover historical and current anthropology, comparative religion, and history. Welcome, and let's get started.
Hello, this is Richard Jacobs with the Good Question Podcast. My guest today is Steve Lewis. We're going to talk about, he's the founder of Nabu.ai, Nabu.ai. We're going to talk about how this technology helps people that deal with adversity. Steve is an internationally recognized healthcare founder, product leader, and a patient advocate. He's known for building breakthrough solutions at the intersection of technology and real-world care. He's the founder, again, and CEO of Nabu.ai. His goal is to transform fragmented health information into a single actionable source for patients, their families, and their care teams. And, having been in the hospital myself a few times and been asked the same question 55 times and they still get it wrong, I see a need for this. So welcome, Steve. Thanks for coming.
Thank you, Richard. I appreciate it. And I really admire the way that you've taken your past experience and translated that into some more impact and telling these stories and also participating in more of the human efforts of the world. So bravo to what you're up to as well.
Oh, thank you. So tell me about how did you create Nabu? Where did the idea come from? Hopefully you weren't dealing with anything too terrible, but what's the backstory?
It was actually a very simple request from my daughter. My daughter, Bowie, was in the process of transferring her care from pediatric services to adult services, which is a bit of a complicated time. You have to dig back into a lot of history and answer a lot of questions yet again. And I was on a mine in a remote part of Western Australia, a place called the KCGM Super Pit, one of the world's largest gold mines. And we had a 3-day power outage and I was going to miss a flight. So I was arranging a support worker to take Bowie to an appointment with a surgeon. And she said, Dad, it's right across the street from my school. I'm going to go by myself. I want to be able to go to my own doctor's appointments. And I thought, fair. Bowie has a long medical history. She has a lot of things to take care of, but she wants autonomy. She wants to be able to have that independence for the next phase of her life as she's finishing high school and going into the more adult stages, which is really exciting. So she made this request and we started talking about, well, what does it mean to be a good patient? What are the things your mom and I do before an appointment, during an appointment, after an appointment? And as we were having this little chat of, this is what I need you to ask, I thought, I'm going to make an app for this so that she can, just for her, it wasn't meant to be for anybody else. I was very focused on what I was doing. And it was just so that she could answer everybody's questions. She could go through the process and she could get the right information that we all needed as a family. So her mom was informed. I was informed. We're not together, but we're in a really supportive relationship where we're really focused on the right outcomes for both of our daughters. And voila, this thing has come to be, this thing called Nabu.
The real leader, is that like from Star Wars or something?
Well, yeah, since putting it out, I've learned that there is a planet in Star Wars called Nabu. It actually comes from the Mesopotamian god of wisdom and literacy who created writing. And I was looking around for what to call this thing after the doctor that first saw it said, I want this for all of my patients. That was the best appointment I've ever had. And I thought, okay, I know he was shining me on a little bit, but I thought, interesting. And then...
Did you ask him why, by the way?
Why? He had all of the information. He didn't have to turn around. He didn't have to go searching. Not only could Bowie answer his questions and his nurse practitioner as well, she could answer her questions, but she also had all of the information required for the next step in one place. So all of a sudden, that single source of information on what tubes do you have? What are our needs? The appointment was a go, no go for surgery. And the decision was made, yep, we can schedule surgeries. So then it was, I need these questions answered. Okay. Those are all the questions we need answered. Here are the things that you need to know about me, my trach size. Bowie's got a tracheostomy tube and a gastrostomy feeding tube, but she was using a very different type of gastrostomy tube that you wouldn't use in in a child and you wouldn't use it for long-term use, but Bowie needed that particular tube. So they needed to know that because it was surgically implanted and not a classic button, right? So there's things that you have to have handy. And she had all of those answers in one place. And then when the surgeon called me and said, I want that, where do you buy it? And I said, I didn't buy it. We made it. And it just sort of started to spiral from there, where I started to walk through, okay, I got the notes from the appointment, right? There's a note taker in it so that I got the summary. Her mom got the summary. All of a sudden, her mom doesn't have to wait for me to have a conversation. She doesn't have to, deal with my mood, if it's early, if it's late, if I'm in a rush. All of the information is clean and unbiased, and everyone's got it. Everyone's got what they need.
It's a little updates that when Bowie was done with that appointment, was she taking notes and putting it in there, or was the doctor doing that? How fast did it get up and by who?
Instantly, right? So there's an ambient note taker. And it's evolved since that first thing. The first thing was just a very basic ambient note taker, right? Fireflies. Fireflies does an amazing job of putting together summary action items. The mood of a conversation gets measured. And that was fantastic, except there was a lot of stuff that was in there that was not necessary. And so as we started to develop the product and spend time with more clinicians, more people on the front lines in various areas, right? ER specialists, intensive care specialists, occupational therapists and physical therapists and general practitioners. We started to refine the interface, and it's not designed for them to use as a clinician. It's designed to be the patient's advocate, the patient's handheld notes so that they can answer the questions. They have the records, right? So when you go through the process, it walks you through, this is why I'm here. We're constantly told when and where to be somewhere. We're very rarely told why as in the medical field. And so that continual reinforcement as to what your goals are, why are you coming? Stay connected to your outcomes, not to the person who's there in the appointment. So you're reminded as to why you're there. You then have the swipe over, just, the common swipe. And you've got your current status of things, height, weight, percentage changes, body mass index, your current medications, any questions you have from the family, the care team, your support workers, everything's in one place. Swipe again. Then you've got your observations. If you've been recording your seizures, or if you've been recording your reading progress or your physiotherapy progress, then you swipe again and you get the ability to take notes. So all of that soft stuff of answering questions and having a conversation, you've got accurate from the home where 99.99% of your healthcare journey lies. You've got that all in one place, ready to answer. And then you've got an ambient note taker so that when that practitioner, that clinician is ready to talk about what they need you to do, you can then have that summary. So it's as soon as your appointment's done, boom, everyone has said, yep, this is why we're here. This is what I need to do next. Now, everybody on the team who's authorized by the patient or the primary care, everybody who's authorized has that information instantly.
Have you ever had a bad reaction when the healthcare person says, turn that off, I'm not using that, I'm not having it recording me or anything?
No, not yet. I have had a few things raised around one doctor who wasn't seeing my daughter. I'm not sure that I would want them seeing my daughter after they said this. They said one of the hard parts that they had with it was if they know something is there, they feel the need to go and look at it. Now, Nabu is not designed for them to have visibility into everything in this person's life. And it's not designed to have the responsibility to convey somebody's thinking. But your doctor should know who else you see, especially if it's a specialist. Your general practitioner, your GP, your family doctor should know if you see an endocrinologist and you're diabetic. They should know if you're dealing with some type of orthopedic surgery, because they need to be in the loop on these things. And there's a lot of really great evidence as to why. The more you engage with your family practitioner, the less rehospitalization. These are actual statistics of billions of dollars that are saved in the healthcare business. Problem is, people don't share the information, and they expect that you've got a lab coat and a laptop so you know everything about me. And that's just, one, it's not possible. And two, it's completely unrealistic that if somebody has access to information, that they've had the time and brain power to go and look at it, right? It's like,
not to be, just from the doctor's perspective, if the doctor sees 30 patients in a day, nothing wrong with them. And, and they're going to be like, okay, I'm on patient 20. Like, what if you're patient 28 for the day? The first has had so much come at them, so much information. Maybe they're tired. Maybe they're like, oh, I want to go home. Today was a tough day, whatever. And, if they're coming at it from that angle, they got to sit there and read the notes. Maybe they'll gloss over them. Maybe not. I don't know. They could make a mistake. Who knows what's going on,
100%. Stuff gets missed all the time. And it's not to be a point of looking for blame or trying to find fault with the system. I'm going to be the last person who puts their hand up to say the healthcare system is broken and I'm here to fix it. I'm going to be the first person to say the healthcare system's broken. Let's look at why. Why do we need all of this new AI technology in hospitals? And it's not because we're sitting around trying to figure things out. It's because we've got so many people not getting better that we need to create more efficiency. We have people who aren't showing up to their appointments. They're not taking the right medication. They're not taking their medication at all. You don't do the physio because you're given all of this documentation. You're given it on paper. You're given it in conversation. And then you go home and you're expected to remember it, or you're expecting somebody else to go through a pile of papers and read and catch up. But the easiest thing for people to do is to go online and search on Google, which is even now a thing of the past. You now go on social media and you ask for information, right? How many times do you go into a Facebook group? I was on one yesterday for Canadians and Americans living in Australia, and there was people asking for immigration and tax advice. And I'm thinking, it's not a defensible position when you're at the border to say, but somebody on Facebook said this was okay, right? Like, good luck. So to think in terms of my healthcare journey, I don't want another internet browser, and I don't want an AI to go in and search the World Wide Web of everything in human history to give me more confusing information, because it's not going to know enough about me. I do want an AI to consolidate my notes from the people that I've trusted to take care of me, to then remind me of the things that I need to do and cross-reference that information with my other providers. Bowie, in my situation, is a complex kid. She's got 11 providers. Right? It's a lot of information. I can't expect each of them to be on top of what everyone else was saying and thinking, even though the records are there. And yet, they do. They go back and they look. We've got amazing people in our world, but it's completely unrealistic to expect that all day, every day, they're continually collating people's notes in their minds when they're walking through hospitals and dealing with surgeries and in intensive care units and on the phone for consultations, right? We need to take responsibility for ourselves. We need to take our medicine. We need to show up to appointments. We need to reduce the waste in the healthcare industry. I mean, man, we're both business leaders. Could you imagine signing up to be the CEO of a company that nobody wants to pay the bill? Everybody needs the service. You constantly have labor disputes, and even on a good day, people are dying.
Yeah, that's terrible.
Imagine being the boss of that business. Let's take some responsibility and let's be better at our own healthcare journey. And there's a lot of people that want that, especially in the post-COVID era. So
there's a lot of people that don't want that too, but I guess they wouldn't use this thing. But your daughter is very proactive, which is great. But a lot of people even sit there and just wait to be told what to do. But this product's not for them people.
Yeah, it's not going to be for everybody. But even in those cases, Nabu can be a very good advocate because it can reiterate what your doctors need you to do without you having to search. And if we continue to grow the way that we're growing, we've got great relationships with providers. If we continue down this path, we'll have the level of interoperability we need for people to be getting that information and being reconnected to their goals without having to ask. And I love this, the way AI is going, we're playing around with features where you can talk to your Nabu account and ask it questions about yourself. We're playing around with, if you miss your medication, Nabu will call you and check in. Is everything okay? We noticed you didn't clear your medication alert. Do you mind taking the medication now and letting us know that you've done it, right? We can't ever, this isn't the One Flew Over the Cuckoo's Nest where we can watch the pill go down the throat and check the mouth, but we can do everything possible to check in with that person and make sure that they've done what they need to do. And in most cases, the vast majority of cases, that's going to be a substantial improvement on what's there. Certainly an improvement on the patient-held technologies that are being offered now, which are mostly just basic data records of an injection, a medication, a prescription, whatever it is, or your lab result.
How are you supposed to know what to tell the provider? I don't know. Like you said, your daughter has like 11. And then you have cancer. I don't know. And you have like 4 or 5 providers. How do you know what to tell number 2 or number 3? Or how do you, like, what does the interaction look like? If someone walks in with Nabu, literally, what does it look like? Like, what's a sample conversation versus what it normally would be?
In your calendar, the notification pops up and it says you've got this appointment with this person. There's a photo of that person. There's your goals from your last appointment. And then you swipe to the right. And when you swipe over, these are your current medications. This is the list of who you've seen in the last 6 months. So that when that provider says, who else do you see? Or when they ask, how did you go with your endocrinologist? You can say, yeah, I saw Helen 4 weeks ago and we talked about this. Oh, can I see the report? Sure. Now they have the full ability to turn around in many cases, they have the ability to turn around and look it up themselves. If they want to talk about it, you've got it on your phone. So at least it's not about saying, here's all of the thinking. It's about eliminating the need for ongoing investigation and wonder as to, is this person, like, are they seeing the people they need to see? Are they on top of their game with their care, right? So we can reduce the time waste and improve the relationship for those people that are using the solution and looking for better outcomes. Fantastic. We've absolutely done our job. And then we can look to see how we get to helping more people. That process is it's like every other app on your phone. It just is really simple user interface with the different steps of, okay, now you know who I've seen. Oh, how's it going with those seizures? Or how are you feeling? Like you mentioned cancer, for example. You had your chemo on one day. You want to have a really good record as to at what point you had nausea. Was it early onset nausea? Was it late onset nausea? You can really fine tune your chemo treatment to try and minimize those side effects. But you can only do that if you have really good information as to what's going on. And I'll be the first to say, I would say with 100% confidence, things happened that absolutely did not happen the way I remembered them. I was tired. I was afraid. I was absorbing stuff from a lot of places. I hadn't slept. We had so many appointments. So accuracy really goes out the window for people, and they take notes in notebooks. They put little reminders in their phones in different places. But then the next parent goes and it's, well, what email address was it? What text message, Facebook message, WhatsApp message? Where do we keep all this stuff? Really organized.
If I go to if I go somewhere and if right after our call, if I took notes on what we said, I'd have 1,000% more accuracy than if I waited like a day or tonight late, So if you do it right then in real time, it makes total sense.
And imagine, I mean, we're at the age, right? I don't know your parents, where they're at. My parents are starting to go to appointments and we want to know, we want to help out. We're expected to help out. Asking your parent as to what a doctor said, good luck. Good luck with our generation, to be able to help your...
I ask you, by the way, is like a lot of these places hold stuff close to the vest. If I need x-rays or whatever, or if I need the report from, I go to the endocrinologist today, and before I leave, how do I know to say, hey, please make sure I get my x-rays or my MRI, and please make sure I get the notes from today's appointment too, beyond what we talked about.
Yeah. Now they're using a lot of AI scribes these days, which are great for efficiency, but a lot of those AI scribes, they're taking ownership of the information from that consultation. So there's a lot of controversy right now as to, should we be allowing those companies that have very open usage policies? I don't know, I've read the terms and conditions of a lot of these companies, and they've got carte blanche to monetize, and we don't worry about that today. But tomorrow, when the insurance companies start knocking, as these AI scribes are posting multi-billion-dollar valuations, we're going to have a problem in a few years when they start to refine what we are allowed and not allowed on our insurance policies, before they start upping premiums because of what's being said in a consultation. So personally, I'm not too happy with a lot of those AI scribes being used, and I asked for them to be turned off. But I want my notes. I want them in my hand. I don't want to have to wait to communicate. I don't want to have the burden of having to communicate with 4 or 5 people outside of the home, right? I do an appointment and I know that my daughter's going to be out of school for a few days, or if my mom's going to have a surgery in Canada, and I can get that notification so that I know when it's going to happen. She doesn't have to tell me and then tell me again. It's already in my calendar, right? So then I can communicate with my work. In Bowie's case, I can communicate with the school, or her mom can, without having to ask me, right? So all of a sudden, that burden that's put on primary carers, which is insanely isolating, it's creating huge mental health problems, even increased suicide amongst primary carers and frontline workers. If we can reduce that burden of having to be that central point of information, more people can help out with care. More people can be in the know who need to be in the know without having to continually hammer that one person for information. What was said? Did you ask this? What did they tell you? Right? All of it's there. All of it's in one place. And that's the thing that we're missing about, we've got great technology to connect us with the clinic and with the hospital. But what we don't have is technology that follows us for everywhere we need to collate that information and process it into another report. And that's what I wanted to achieve out of this, because so much of my time was being taken by the school needing updates and the community program needing updates and our national disability scheme needing updates, and her mom and myself keeping on the same page just amongst us. And we're in an amicable relationship. You get people who are weaponizing their kids, where it's not what's being said, it's how it's being said that's creating arguments, and arguments end up in more stress. And then what happens is the child suffers, or the elderly person suffers because the fighting that's going on around them. Let's do away with all that. Let's just focus on our goals and our outcomes, and let's reduce that pain that's going on. I mean, you've been there. You mentioned, your hospitalization. What was that like? Having to tell that story 1,000 times and then tell it again to your parent and explain it and your partner. How did you go with that?
Well, even being in the hospital, they ask you the same question 10 times. I don't know if they do it just to, supposedly some people said, oh, it's because then they actually get the real truth. You may not have to say the right thing to somebody, whatever BS, but I just think they don't listen. I just think it's like they go to McDonald's, oh, hi, how can I help you today? And they just, they do their job. So that was one annoying thing. Sometimes these things can drag on for, I had thyroid cancer, so that's not a 2-second thing. It drags on for years. So this was over COVID. I couldn't get in to do certain scans. Then they had the balls to say, oh, it's been this long. You're considered a new patient. We don't have any information. We got to get new information from you. I was like, no, not doing that. Like the nerve of them doing that because of their who knows what record keeping. Just it was ridiculous.
Yeah.
And I can see you get much, much, much better care if you have all this information in one place. And the thing I was going to ask you though is if you have ongoing problems, unfortunately like your daughter does, it makes total sense. But what happens if, you're more of a person, let's say they go through some kind of illness and then they get better and then nothing happens for 6 months and they forget and they have to go to the doctor and oh, that's right. That the Nabu thing, I totally forgot about that, How does someone use it long term where it reminds them not in an annoying way, not in a bad way? It's there to help them throughout their whole journey. I mean, like this is too new, but what happens when it's been out for 10 years and someone's been using it for 10 years or not using it for 10 years? It's just interesting to think, like if you look at, let's say a 50 or 60-year-old person right now, and we go to doctors for 20, 30 years, how are you ever supposed to get that old information? It's so long gone. In the future, great, but it's just questions that come to mind.
Yeah, absolutely. And really important questions, especially for, early stage companies often fail because they haven't thought through those big questions, right? If you can't find those tracks early on, often you don't have the resilience to stay. You don't have the funding to have the staying power to really see your full potential, and the cracks start to show. And so our approach to how we're going to deal with that is to really look at some specific pathways and specific user groups. Like one of the big ones is neonatal care to discharge. So you'll have, in many cases, you'll be into an intensive care unit in one hospital or one area of a hospital, and you'll be discharged to another. And you'll need to have better coordination and communication in the family. So we're looking at that NICU discharge process.
I think I got one here for you, by the way. Yeah, well, not overstepping. So let's say when your baby is born, you're going to use this, like at first, I know this will feel probably outside the scope, but maybe it's used first as a pregnancy tracker. And then when the event happens with the hospital, you're using it for all that stuff. But then let's say you would normally stop using it, but now it morphs into like a childhood or baby progress tracker, if you get any vaccines or baby exams or blah, blah, blah. And then let's say, I don't know, like I said, cancer, I use it for my thyroid cancer. And now I got my scans. They told me I'm good. I'm done with that part of my use of the medical system. But maybe now it offers me to track my food to keep me healthy, or it offers to track my exercise. Like it morphs into something else so that it has a reason to stay in my life forever.
100%. So the way that we've addressed that, and I really like the thinking, and I appreciate that. The things that we're looking at are those transition periods, and there's a number of them, especially when you look at intellectual disability healthcare, or you look at people with the long-term chronic illness, where you would run things away for a period of time, but need to come back to them, right? Like you have to do an update for a government body or an insurance or a provider, and you don't want to have to go back and find those documents. So we are looking at those transition periods and how we can follow along. The point of when somebody's born is a great one. And the NICU example is it's a hard time for families. It's a lot of premature birth. It's a lot of, what happens, chronic illness or conditions that then need to be tracked. And you have generally two parents that are now in a different world, a world that they didn't know existed. I was in that position. I was working with rock stars designing clothes one day, and the next day I'm standing in the neonatal intensive care unit at Cedars-Sinai Hospital wondering, is this Mars? I've never seen any of these things. I've never heard these terms. Everything around me is new. It's confusing. They're speaking a language I've never been in the same room with. And yet, at the end of those conversations, highly educated, experienced people, they put a piece of paper in front of me and they say, do you understand? Yes. Do you consent? Yes. Do you take responsibility for what happens next? Yes. You don't have time to get a second opinion. You don't have time. You have to do this now. And you think, oh my Lord. So to be able to try to support that period is really important, to then make sure that the parent that's at work, trying to keep the house going, is on the same page with the parent who's in the hospital without them having to continually hammer down on them, because there isn't an appreciation for how stressful that environment is for everybody, for the providers, right? I've seen nurses in tears in a corner. I've heard, I've been in the room where a surgeon sat down and they've talked about, the insanity from the night before, and they're still on shift because of something that happened. And it's just been problem after problem after problem. And you think, we have to trust you. And I have 100% respect for what you're going through. It's really, really hard. And you do it time and time again. Like things I think of, I relate it to teachers, right? Parents complaining about teachers who can't even control their own kids at a dinner table. Imagine having 30 of them for 8 hours in the day. You think, right? We have to appreciate it more. We have to take responsibility. And I don't know if I had a crystal ball or if I could tell you the future. I would love to be able to paint a big rosy picture, but I'm tackling this from the patient's journey, the biggest problems in health. And I'm tackling it from the needs of the individuals that are in really tricky situations. And I have a huge amount of empathy for the frontline workers around intellectual disability care. And I can see where the gaps are coming, having lived this path. And so I'm trying to use my experience, this life. I wasn't given this life. I didn't choose this life. I was given this life, but I do choose what to do with the experience. And I want to use it to try and help people avoid pain they don't know they have yet, and have that impact. You look at the life expectancy of somebody with an intellectual disability is 20 years less, not because of the condition they have, but because of the accessibility of care. 20 years difference because of the accessibility of care. And when you go from one system to the next, especially the transition from children to adults, where you have a huge amount of demand on the hospitals and the providers and less resources, you can see where those gaps get wider and wider that people can fall through because there just isn't the availability there. We need to find ways to stay better connected, to keep families better connected and engaged, so that we can minimize that real big problem. And it's a growing problem.
Like you mentioned older parents, so mine are passed away, but if your parents are older and they're starting to have maybe signs of dementia, or they have to go to the doctor all the time, can they elect through the app to share stuff with you without having to be with you? Or can we
Absolutely.
and then you have them give permission for someone to bug you. Like, let's say you got to take a pill every day. Like my mom has to take a pill every day. And can the app say, like, remind me to say, hey, call mom every day at 4:00. Mom, you take the pill or what? The bugger. I don't know if those features are going to be baked into it.
Absolutely. So we've got that built in now. In Australia, we've even gone the extra step that if you're engaging a support worker to help your parent or your child, it does a police check on them. It does a driver's license check if they're driving your family around, a working with vulnerable populations certificate, which is what we have here for working with children or working with people with disabilities. You get licensed, and it will check those not once, not maybe in 6 months as agencies might do. Every week, it'll check those. So that person who's driving your parent, didn't get a DUI on the weekend and is going to end up stranded somewhere because they got pulled over, or, even worse, heaven forbid, you don't want to think about it. But the predators that are out there, and they are out there, and they change jobs and they change states and they jump around to avoid the law. But when they've got a hit on them, you need to know it, and you need to not onboard them. So we've gone to those steps, and we're going to look for how we can implement those solutions in other territories. At least in the beginning, you can make sure that that person who's helping your loved one know everything that they need to do in a day, and you get that score at the end of the day. There was 10 tasks, 10 of them were done. If one is missed, you're notified. If one is critical, like a medication timing, some timings of meds are really critical, you can get that phone call, and you can elect to give permission to other people to have that information as well.
The last thing you wanted to bring up, I bring it up because I've heard this a lot. A lot of medical people gaslight their patients. Oh, it's all in your head.
Yeah.
How do you see that interacting with this?
Look, and that's really tricky, and it's a bigger problem than we think, because there's also the diagnostic overshadowing. You get somebody who's having persistent headaches, and the person's saying, oh, well, you need to drink more water, or they're looking at other lifestyle factors to justify their decision making. That overshadowing is even worse when it comes to intellectual disability. From my perspective, and having been in some of these conversations, the ability to have really good records as to when and where things happened is really important, because you can then point back to, I brought this up at this time, this has persisted, it's, these are my pain scores, it's this frequency. You need to be able to then, if you go to another provider, have some really good information to back up why you're seeking a second opinion. And the more accurate records you have, the better service you'll get. In the future, as we start to evolve our AI capabilities, we'll be able to help give authority to the people so that they're not feeling dictated to by a person. Too many people come in and they'll say, I've read this article, this is what I've got. They don't come in and say, I'm concerned about this because I've been having these symptoms over and over and over again at these particular times, and allow someone to go through their process. And people get really put off by that being dictated to, because it also comes across when you have drug-seeking behavior, when you have, people that have the different mental health conditions that, are seeking help or pushing other people to be chronically ill so that they can be caretakers. Like, there's a whole slew of things that we're going to have to deal with as our journey goes on. And it's really tricky. This is why we're spending a lot of our focus engaging with clinicians across all of these areas, especially in the research hospitals and the different specialists, so that we can get all of those insights into our development path. And I take my hat off. We've got some incredible people who have been supporting this journey, and we're now going into a period of pilot programs with clinicians in some of our leading hospitals in Australia, as well as some providers in the UAE. We've got a lot of love out of some great folks in America. I can't mention any institutions at this point, but some serious heavy hitters in the oncology space, in intensive care, as well as in the community programs around specific disabilities like Down syndrome, like mitochondrial disorders. And, I'm truly, truly blessed. You're talking to one person who's standing on the shoulders of some pretty significant giants around the world who see this as a critical needed solution, and our approach being a really great way to start. So I'm really, really lucky that there's some great supporters out there.
So, well, very good. So what's the best way for interested people? Can they just download the app and use it, or how do they start to get on board?
By the time this comes out, the app might be in the App Store. So we're doing some pilots now. You can reach out. Our website is Nabucares.ai, Nabucares.ai. You can find us on LinkedIn. There's an Instagram page, and we've got the younger, hipper people starting to put up some social things. I'd love to hear from everybody. So definitely reach out and sign up to a pilot program where you can get the app into your hands and start working with it. But yeah, so the website's the best place. LinkedIn, Instagram are also great. And look forward to hearing from everyone.
Excellent. Well, Steve, thanks so much for coming on and sharing your story and for making this. I hope it grows to be a pervasive thing where it's used all over.
Yeah, man. Thank you. And thank you very much for the work that you do. I hope everyone listens to a lot more of your episodes where you've got a good focus on technologists, on entrepreneurs, and, crazy knuckleheads like me who are just looking to put out products that make an impact. So my hat's off to you for putting these stories out to the world. I really enjoy listening to them, and I hope people like, follow, and share these episodes. There's some awesome stories here.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
Thank you for listening to the Good Question Podcast. Please email support@thegoodquestionpodcast.com if you have any referrals to great guests for us to interview. Visit thegoodquestionpodcast.com to hear more interviews. And please help us spread the word by rating and reviewing us on Apple Podcasts, iTunes, Spotify, YouTube, or wherever you listen to this podcast.